Hello and welcome back. This is me, Hassan. I am one of the co-founder and an instructor for the FRCEM Course Academy, and hopefully you are doing well. Today we're going to talk about DNR, do not resuscitate, or DNACPR, do not attempt CPR. A very important topic, particularly for us working in the ED and those working in the critical care. We are facing this situation much frequently. So we need to have an idea about the steps and the process of the DNR. And then as well, it is also considered to be one of the important topics for the exam, particularly for the OSCE exam. So they're testing the knowledge and the experience for candidate who is doing the exam regarding the DNR and how the process can be conducted with the patient or with the relatives. So, sorry guys if this audio lecture is a bit prolonged, but we need to cover many aspects and just like to increase the awareness about this very important topic, and you need to be familiar with it, and you have to have an idea about how these things can be done, particularly in the emergency department during the busy shift. So let's start with the case. So you have been asked to come to the Resus urgently to see a 93-year-old patient who presented with shortness of breath. The patient got a background of terminal COPD on home oxygen, and patient got heart failure with ejection fraction of 30%, and patient currently is febrile and pyrexic with temperature 39.9 and saturation of 70 on room air, and with decreased level of consciousness. So I'm assuming that the initial steps for this patient, that you need to initiate the resuscitation steps initially, and then I'm assuming that you're going to consider the possibility of DNR, taking into consideration the background of the patient and the current status now in the resuscitation room. So how the DNA CPR or DNR decision can be made. So the definition of DNR, so it is just like in case if the patient condition deteriorates to the point that their heart might stop, we are not going to do the chest compression or putting tube inside the mouth to help him breathing. So this is the definition of the DNR. Who is responsible to initiate this decision? Is it a medical decision, or is it patient wishes, or who is responsible to initiate this decision? So the decision is medical. The DNR decision is medical. So we are a healthcare provider. We have the potential and we have the power to make this decision based on the condition of the patient and based on the comorbidities and based on age. But age is not a mandatory factor for which we need to initiate the decision of DNR. It is rather the presence of comorbidity of the patient. So it is a medical decision which should be made by us based on the current condition of the patient. So the age, as I mentioned, it is not the only factor which we need to consider, because sometimes we might initiate the decision of DNR for significantly comorbid patient, but patient patient is not old and patient is young, but having quite significant comorbidities, for which we need to also follow the same steps of DNR. In several conditions, some patients might already had this decision done for themselves before. This is which we call it advanced directive or living well. So here, the situation that the patient had a full capacity at some moment, and he decided for himself that in case if his health deteriorated to the point that his heart might stop, they mentioned that they don't want to be resuscitated aggressively, and usually those patients they have the form signed with them when they are attending the ED with ambulance or with the paramedics or with the patient's relative when they're coming to the ED. They have already the decision, and they got the paper with them that they already had an advance directive regarding the type of care which they are going to receive. Right. So before starting this station and before starting this sensitive talk, it is quite sensitive. So we need to prepare ourselves mentally, and we need to make sure that we picked a right person to initiate this talk, because this talk is quite sensitive and it should be done in the right way with the right person. If we face that the situation was not okay, the condition or the situation, or we pick a person who was not competent to initiate this decision, and things went into bad direction, there is no any chance and there is no any way that for someone else can come and to repair the damage. So we need to pick a right person with a good communication skills and to initiate this talk. And this talk can be either to the patient himself, or it might be with the patient's relative. So you need to prepare yourself mentally, and before starting the talk, you need to invite the relatives to the calm area for which you can have this discussion appropriately. But you cannot initiate this talk with the relative just like in front of the bed or standing in the busy emergency department. So you need to pick a good place, quiet place, and then offer them to sit. You need to have a chairs, and then you have to sit with them, and you need to prepare yourself before that, and then you can initiate the talk. So ideally, every one of you guys got his own way to communicate regarding this decision, but I'm just like recommending that to start the talk and the conversation after confirming their relationship and after introduction of yourself to them, that ask them about their current visit. So what's happened? And regarding your loved one, I assume that you brought him today because he was not feeling well. But tell me more, please, about his current condition recently before you coming to the ED. So here, they will start to tell you about the deterioration of his health, and that he was not or she was not feeling well at home over the last couple of days, and not eating, got fever, coughing, or so they will give you the initial symptoms of the patient. So here you can state for them that yes, we've received him and currently he's in resuscitation room, and our colleagues are taking care of him or taking care of her, and his situation is quite serious. So I strongly recommend to give these warning shots. This is at least will be a good preparation for what is coming next. So tell them that their loved one is quite sick currently in the emergency department, and your colleague are taking care of him or of her, and he's quite not all right. So I think this will be a good warning shot for what is coming next. And then you need to explain clearly the issue about DNR clearly in very simple, understandable word. As I mentioned, so each one of you got his own way of talk or his own way of communication, but you can just like pick this an example that yes, your loved one currently he's on resus room, and my colleagues are taking care of him, but he's quite sick, and ideally in the emergency department when we are receiving such patient, who their illness is quite advanced, there are two options that either they might get better, or the other option that their heart might stop because of the advancement of the illness. Ideally, in this situation, we're just going to initiate chest compression, which is called CPR, which is cardiopulmonary resuscitation, meaning that we need to jump on the chest and start the massaging of the heart by doing just like some compression on the chest to revive the heart back. And sometimes we need to put a tube inside their mouth to help them breathing. But in the condition of your loved one, this will not be the case. And here I'm strongly recommended that you need to give them the reason for that, and don't stop at this level. Just keep talking and explain the rationale before they're starting to ask you why you are not going to do that. So before the why, you need to continue giving them the rationale of not doing this chest compression or putting tube inside the mouth to help them breathing. So the rationale usually will be the advancement of the illness and their level of sickness, which is quite significant. And even though if we initiated this chest compression and your loved one come back after these chest compressions, he will not, or she will not be the same level as they were before the heart stopping, and it will be a cycle of suffering, and then again they might go into another cardiac arrest. The heart might stop again, and then it will be just like we're doing a cycle of suffering. And each time he's coming back or she's coming back, they will come in less level of awareness and less level of good condition as they were before. So it will be a cycle of suffering. So this is the rationale for you that you need to initiate this decision of a chest compression. So and here I'm strongly recommend that when we started this talk, I know it is a medical decision, but when you start this talk, you're not coming to the relatives or to the patient himself or herself, just telling them that you are sick, and if your heart stop, we're not going to do any chest compression, and this is medical decision. We have taken this decision. So I think this is a very not appropriate communication with the patient. So like this, you're going to lose the rapport between you and between the relatives or between the patient. So I'm just going to break it as a discussion rather than breaking or informing them that we already came to this decision. So I'm strongly recommend to make it as a discussion rather than just break it like an information for them that we already took this decision as a medical staff or as a healthcare providers. Right. And after you already initiate the talk and you explain the rationale behind the decision of not doing this chest compression, and so here you already gave them a not pleasant information, but at least you need to give them the good things, because here we need to make it clear for them that after this decision had been made, or that we're not going to do this chest compression, but we're going to provide the patient or provide the your loved one with the full medical treatment. So to increase your awareness about the decision of DNR, so DNR doesn't mean that we need to leave the patient to die without provision of any medical treatment. No, so DNR is just like for chest compression and putting tube inside the mouth, but otherwise the full medical treatment should be initiated the same as non-DNR patient. So the patient should receive an IV fluid, the patient should receive an IV antibiotics. If there is any image should be done or a scan, that should take place. And full treatment should be provided to the DNR patient. So we need to give them this statement, because the relative sometimes might understand that by this decision or by this talk, you mean that they're not going to receive anything, rather they're just going to stay in the ED until they either die or to survive. So you need to make it clear for them that this is just like only for chest compression in case of heart, if the heart stop. But otherwise, we're going to provide your loved one with the full medical treatment as needed. So now I have a question, and I'm facing this question a lot of times during the course. Is the DNR patient is the same as the patient going to die? So the answer is definitely no. So here we don't know. Patient might survive. Patient might respond to the medical treatment, and even to the point that some patient, we label them as DNR, but they manage to survive the admission of the hospital until they've been discharged at home. So you cannot mention to the relative that if they ask you a question that our loved one is going to die, so don't answer that question yes, because you don't know. It is 50-50. So their illness might advance to the point that the heart might stop, but at the same time, there is a chance that they might survive this visit and they might respond very well to the medical treatment. So tell them that we have the two options there, but we're going to hope for the better option that your loved one might respond to the medical treatment. We're going to hope that your loved one is going to respond to the medical treatment. The other point I want to talk about, I've noticed also people when start to talk about DNR, they are bringing the matters of breaking ribs into the conversation, and I think this is not the right way to speak about DNR, because the rationale of this decision, not because the patient is fragile or the patient is elderly or thin, and there is a risk of damage to his ribs. I think the rationale is way beyond that. Because of the advancement of the illness and the presence of comorbidity. I think this is the main reason for you initiating this talk about the DNR. It's not the description of the chest compression or the complication of the mechanical compression. So this is not the reason for that. And I strongly also recommend not to mention breaking ribs as a rationale of this decision. And here also you can augment this sensitive conversation with to give an examples either from your real life, or if you met any example before about this situation, you can augment that, and this is also might help you communicate with the relatives, and I think this will be also just like a justification or supportive point to your talk about the DNR. So give examples, avoid talking about the breaking ribs, and give the rationale, which is the advancement of the illness. Sometimes the patient himself or herself or the relatives of the patient might request you to go for DNR, and here I'm still recommending that it is already a medical decision which be made, but it is wise to communicate or to answer this question with more explanation behind the rationale of this decision. So they have the right to take a second opinion if they want, but the relatives or the patient himself or herself cannot request that. So the decision is medical, so which is overruling the wishes of the patient. But you're not going to tell them that you cannot do that. So just like communicate with them in a good way and try to understand their current situation, because now you are talking very sensitive, and you are touching very sensitive things, and this is just like touching their loved one, and so you need to show some empathy and understanding to their point. So try to build a good rapport and tell them that yes, so this is the right decision, and I'm sure you're going to agree with that. Even though if we did this chest compression and putting tube inside the mouth, it is inappropriate medically because of the advancement of the illness, and because of the current situation. The body became weak and the immunity became weak to fight all these current situations. So be empathic and try to show understanding, but they have the right to go for a second opinion if the relatives or the patient himself got some wishes about that. So you need to agree for that. And and at some point we are seeing patients in the ED and we don't know the current situation and the current status of the patient. Sometimes it might be clear from the ambulance note, or when we're getting the handover from the paramedics, that the patient has already got a DNACPR form in place. But if we don't have that form in place, so you need to make sure that you got this decision very fast and very rapidly. You need to initiate this decision, and particularly if you are working in the ED as a senior one, you have the right to go for that, particularly if you are doing the night shifts and you are the most senior one. So you have the right to initiate this decision if you see that it is appropriate for the patient, and it is going with the best interest for the patient. But sometimes we can initiate the chest compression even though, despite if the patient has got in place a DNA CPR. It's quite strange, but there is some immediate reversible things for which, if we conduct it directly, patient might revive back. So I will give you an example. So a patient with a DNR came with MI and all of a sudden went into ventricular fibrillation. And you know that patient with ischemic heart disease, if they got early defibrillation, there is a big chance that they might come back. So in this situation, sometimes we are just like overruling this decision, just like because there is imminent reversible causes in front of us, which for which if we intervene earlier, patient might survive. So in this situation, sometimes we can do the chest compression and shocking the patient early if we know that the patient might come back immediately, and the reversible causes of the cardiac arrest is manageable. And sometimes the patient with DNR form, can they go to the ICU? This is also a big question for which we need to have an idea about it. So it is case by case, but sometimes if the patient needs a specific advanced treatment which can be provided in the ICU, or there is a bit of specific observations which need to be conducted for the patient in the ICU or critical care or HDU settings, patient might go there. So the answer is yes, if the DNR patient can go to HDU. Not all of them, but selective cases, and it is case by case. So there is a chance for that. So the answer might be yes, depend on the case of the patient and the current status. So coming back, just like wrapping about the major points in the DNR, which we need to keep it in mind, that we need to make the preparation, and I think this is a key point when you are having this discussion about DNR, that you need to prepare yourself mentally. Otherwise, if you are not going to do this conversation, you need to pick a suitable person for that. person with a good communication skills, and patient with or a person with a good empathy, and who knows how to conduct this conversation in a good way. Because as we mentioned at the beginning, if this conversation went wrongly, it will be extremely difficult to recap things back and to repair the damage. So we need to make sure that things are good from the beginning. And remember, when you need to start the talk, you need to start with by asking a couple of questions regarding the current situation and the current status and what's happened prior to their recent visit. And some people also might having their own approach regarding the initiation of the conversation. They might ask directly if their loved one already got any advanced decision in the past, and or ask the relative, what do you think about the current situation, and just like start with the open question, so to gather more idea and to know what the ideas for the relatives about the current condition of the patient. So might help you guiding through your conversation. So you can start with a couple of questions before starting your talk. If the patient already got an advanced directive, so I think here we are good, and there is no major concern. The concern will be for the patient who didn't got any advanced decision in the past, and we need to initiate this decision in the emergency department. So those are the general points which I wanted to talk about them in details regarding the DNR. And the last point, I want to wrap it with you guys before ending this session. That remember at the beginning we mentioned that it's already a medical decision, but when we start this talk, we started as a conversation. So here, after you reach the point of agreement for the decision, you need to clarify for them that this is a medical decision and it is done by us, because sometimes the relatives might start to think that they are the one who gave this decision for their loved one to not do this chest compression. So we need to take the guilt off their shoulders, and we need to explain for them that this is a medical decision. It's not their own decision. So like this, we are just going to remove any possibility of feeling guilty about this situation. So it is a medical decision. This is a very important point which should be conducted at the end. And remember to be empathic, and so for you this is just like a conversation of 10 minutes, and then you're going to continue your life and you're going to continue your things, and maybe after a couple of minutes you're going to forget all this conversation. But I'm sure those families, they are not going to forget this conversation, and they're going to remember that for life. So here you need to leave a good memory for them about this conversation, rather than and to having a bad argument and bad conversation. So you need to make sure that you are being empathic and you show understanding, and you manage the situation optimally. And remember, you need to treat other people the same way that you want to be treated. And that's it. So hopefully next time we're going to talk about the other topics, and we might come back again to discuss more DNR questions. Thank you very much, and see you